Hello again. Happy to meet you, and following yesterday's inspiring and provoking opening plenary, I would now like to suggest a different form of decentering. Let's shift our focus on life, birth, death and body in migration and in mobility. As many of you know, the Institut Convergence Migration has a particularity. Beyond our approach across the social science and humanity, we are also deeply engaged in health science. Within our Department of Health, we do not have only epidemiologists and public health specialists, but we also have practitioners, clinicians, medical doctors, psychiatrists, psychologists, midwife. And our fields of inquiry are deeply engaged also. I mean, we work in conflict zone, in border areas, in boats, the boats of the Mediterranean. We do also work in maternity wards. We are working in the very frontiers of life and death. So this perspective, this roundtable invites us to decenter migration studies in a different direction at the tension between life and death. The discourse, the scientific discourse surrounding this tension is caught between different paradigms. On the one hand, a political narrative that reduces the body to a functional instrument where mobility becomes a matter of permission and control. On the opposite, there is a whole paradigm of freedom. For some men and women, migration holds the promise of life, of escaping violence, domestic violence, forced marriage, etc. Also, mobility can offer the possibility of rethinking the female body, the fertile body, very differently. So, from which perspective we can question all this? This is going to be the subject of this roundtable. The migrant body is layered with meanings and representation. We are going to deepen all these questions with our guest today, a keynote speaker whose knowledge and hands-on experience in the field are both very rare and very precious. So it's through their expertise and practices in situated practice and fieldwork that we are going to challenge these paradigms and methodology. If you allow me, I'm going to present each of you and then give the floor. Amrita Pande, you are professor at the University of Cape Town in South Africa. Your work lies at the intersection of gender, globalization, intimacy, focusing on transnational reproduction, repro-genetic technologies, and multimodal ethnography. Over the past 2 decades, you've been conducting multi-sited fieldwork in fertility clinics, investigating the cross-border movement of eggs and reproductive mobilities in India, Cambodia, Ghana, and South Africa. Your recent books include Epistemic Justice and the Postcolonial University, and a second book, Birth Controlled, Selective Reproduction and Neo-Eugenic in India and South Africa. Her book, Wombs in Labor, Translational Surrogacy in India, has been made into a multimedia performance, which is called Made in India, Notes from a Baby Farm, where you perform across the world. You focus on how the concept of mobility and immobility, as well as structural inequalities, sustain the global fertility industry. Your approach profoundly reorients our understanding of mobility through the lens of reproduction and global inequalities. Jean-François Corty is a medical doctor, political scientist, and anthropologist. Since 2023, you are the president of Médecins du Monde, a major international medical NGO. With nearly 2 decades of experience in humanitarian and medical social action in France and abroad, you've been holding numerous positions with Médecins Sans Frontières, in Eritrea, in Liberia, in Afghanistan, in Niger, and in Iran. Jean-François is also an active partner of ICM, notably collaborating on research action focused on Palestine. And Jean-François, your latest book is called Géopolitique de l'action humanitaire, and it offers a sharp, critical reflection on the core principles of humanitarianism, and you're questioning its ethical and political frameworks. For your information, there is a stand of Médecins du Monde at the Civil Society Forum where you have to go It's very important. This stand is very, very interesting, and they are very happy to share information with you about Médecins du Monde activities. Michel Agier, Michel, here you do not need introduction. I mean, we are familiar with your work. You're a foundational figure of the Institut Convergence Migration. You've been the director of our department policy. You're a leading anthropologist. You're professor at the École des Hautes Études en Sciences Sociales, one of the founder partners of Institut Convergence Migration. You are an emeritus senior researcher at the Institut de Recherche pour le Développement, who is also a founder partner of Institut Convergence Migration. You have a lot of research on urban anthropology and race in Africa, Brazil, Colombia. You've been focused on your work has been focused on border zone, on refugee camps, on the migrant condition in both Africa and Europe and Brazil. Your most recent book is called Racism and Culture, Racisme et Culture, Exploration Transnationale, and it offers a vital critique of the cultural underpinnings of racism rooted in ethnocentrism and colonial legacies. Michel, your work continues to illuminate how categories such as vulnerability and undesirability are mobilized in contemporary migration governance. So please, Amrita, I'm giving you the floor to start with.
Okay. Thank you, Marie, for that. And thank you for the teamwork in bringing me down many borders to here, the heat wave in Paris, which I'm told I brought, but I didn't. It was actually very cold in South Africa. What I want to do today is, the reason why I have my computer here is that I am going to read a little bit from my field notes, because this is an interdisciplinary, multilingual crowd. So Michel has asked me to speak very slowly, which I'm doing. So I'm going to start reading 2 field notes so that you get an idea as to the snapshots of my journey for the past 2 decades. And as Marie just very generously said, I have done ethnographies and global fertility clinics in India, Cambodia, Ghana, and South Africa mostly. So these stories are about bodies, borders, and reproductive labor. And they, in some sense, provide the grounding to the questions that I want to ask you all to think about. Why should a conference on mobility and migration care about egg providers and gestational mothers, or surrogates as they're called in layperson language? Why should we care about reproduction and futurity in a conference on migration? So field note 1 is, I wrote it in 2007. This is Hope Maternity Clinic in Gujarat in India. A long room is lined with 9 iron cots with barely enough space to walk in between. There is nothing else in the room. Each bed has a pregnant woman resting on it. I walk up to the last cot where Yashoda, a 28-year-old widow, is resting after a surgery. She has been hired as a surrogate by a single man from Spain and is pregnant with triplets. On the client's insistence, one of the fetuses has been surgically removed. She starts telling me her story about her husband's death, her in-laws abandoning the widow who dared to become pregnant for some foreigner. When she breaks down in the middle and starts crying, the surrogate on the 3rd bed gets up and completes her story. By the end of the conversation, 8 of the 9 are sitting around the bed, talking and listening. All agree that Yashoda need not feel guilty. She has done nothing immoral. Munni, who's another surrogate in the dormitory there, adds, "Go and tell your in-laws, at least I'm not sleeping with anyone." Field note 2 is from a more recent time, May 2019, and now I am in a winery in Durbanville in South Africa. Durbanville, for most of you who won't know, is a small town near Cape Town. Very different setting from the surrogate dormitory. I'm in the cellar of a beautiful winery in the outskirts of Durbanville, where a group of 18 young white South African women are gathered for Egg Donor Day. The team will soon be traveling to Cambodia to donate their eggs and also do a bit of snorkeling and beach hopping. Candice, who's 28 years old, has donated 6 times for a global traveling egg provision agency. She has organized the social so that the girls can ask questions and ease their anxieties about travel and donation of eggs. If an experienced donor manages to bring a friend along, she has a chance to win a luxury spa package. The room is full, word of mouth, or spa. The advertisement of a spa works. There are glasses of champagne, wine, and chocolate pairing, very beautiful cakes. There's also a professional photo shoot to seal the team's camaraderie forever. The experienced donors talk excitedly about the adventures to expect, and Candice promises them that snorkeling in caves in Cambodia is something they would never forget. The talk about rules, injections, the pain of hormonal treatment and egg retrieval, and don't even get me to the long-term effects of egg provision is all forgotten. Today is the day to mingle with travel egg buddies. So again, these 2 field notes and my focus on gestational surrogacy and egg provision might seem quite niche, but in fact for the past 2 decades, that's exactly what I have been trying to argue, that these kind of conversations need to come to humanities and social sciences and not be kept only to scientists and laboratories. It's very much at the heart of the conversations we started yesterday around mobility and immobility, especially when viewed through the lens, which I like to take it, viewed through the lens of labor, race, racialization, and global stratification. So why the lens of labor? Because that might sound counterintuitive for something as niche as that. But assisted reproductive technology in the last decade or so has made the making of a baby a global enterprise, literally a global enterprise, where there's been a global turn, but also a southern turn. So partly because of the cost concerns, so people can't afford ART or IVF in many parts of the world, so they travel to southern countries, but also because of many stratifications based on race, caste, class, and of course gender. There are also restrictive laws in many parts of the world because of which patients, or who we like to call intended parents, have started crossing the borders of not just countries but continents and traveling to Asia, Africa, South America, and what I call the global East, so the lower and middle income countries in Europe, to have genetically related babies for them or to have a baby customized to their preference. So literally the task of making a baby has been divided into neat segments, and each part has been outsourced to different countries in the global south. I'm sure I'll have the chance to talk about all this in the Q&A if there's one, but I don't want to take too much of your time. But I do want to, in the first couple of minutes that I've been given, but I do want to start saying that it is really important to stop yourself from seeing it as a sensational topic of baby farms or black women having babies for white intended parents. I've been asking people to really engage with the real, the messy aspect of this trade without getting caught up in moralizing and ethics only, and get to think about the complexities of this by understanding southern hierarchies, understanding the colonial past of these countries, the post-colonial presence of these countries, and also understanding that these stratifications are not just based on gender, but also class, race, caste, and ableism. So essentially what I'm asking you to do today is, as we dialogue together, to think about these new technologies as something that you and I really need to pay attention to if we want to think about a just world. Do I have time to talk a little bit more? Yeah. So what I wanted to talk a little bit more about is how I got to this lens of labor and stratification beyond gender, and why I'm constantly being invited to forums which are all about bioethicism. So when I started my work on surrogacy in India, this was 20 years ago, And whatever I came across was very interesting, but it was all written by radical feminists sitting in the United States or Europe. And I was very influenced by them, and I also went to India thinking that I'm going to find baby farms where black women will be breeding white babies. But as I started living with the surrogates, whose life I kind of read out to you from my field notes, I realized that my very northern and Eurocentric understanding of gestational surrogacy is going to be not just inadequate, but irrelevant for what I'm witnessing in India. And then after that, as I started doing fieldwork in Nepal, Cambodia, Laos, Ghana, and South Africa, and now in Kenya, I realized that that kind of theorization is just not going to work for what I'm witnessing in these southern contexts. Because these women are not just surrogate or substitute mothers. In fact, they are trying to negotiate a whole lot of other complexities which go beyond this production-reproduction binary. They are, for the first time, they say, and they say it to me all the time, for the first time, they are producing something of value. They're all women who used to work in factories producing glass bangles, shirts. For the first time, they were producing something that was not temporary and something that was being celebrated as their own contribution. They were being fed and pampered, albeit surveilled as well, in these dormitories where they were being given the best food, the best medicine, and the best technological care. They couldn't have afforded that for their own pregnancies, and now suddenly they were being forced into this biomedical world. For the first time, these women were being celebrated for being fertile. Don't forget the context is India, which is an antenatal country where for the longest they had been told that it was their fertility which was not just making their own family poor, but the entire nation poor. So this is exactly what I called neo-eugenics in my first book. That is the women, a subtle form of eugenics whereby the neoliberal notion of consumer choice justifies promotion of assisted reproductive services for the rich, and at the same time by portraying poor people as strains on the world's economy and environment justifies aggressive antenatal policies. But I'm going to quickly jump a little bit so that we can also start bringing the white egg providers into the pool. So what is the story about these mobile white egg providers, and why am I talking about them in comparison to these very immobile, metaphorically and physically immobile women in these Indian surrogacy hostels? Because there are very interesting concepts of race and racialization happening in this desire for whiteness. So when I started studying this global fertility industry, my first attempt was at just understanding the gestation part and the surrogates. But it's an entire trade, and egg providers play a very important role here as reproductive laborers. But their role is quite different, because unlike just gestating black women whose characteristics people don't really care about, because don't forget they're not providing the so-called genes, so it doesn't matter what your color is, what your race is, what your linguistic ability is, whether you go to an Ivy League school, college or not. But for these egg providers, genetic matters. So why white South Africans from a majority black country, South Africa? So the irony of that should have resonated with you, and it did with me as well. So these white egg providers are flown all over the world. So their mobility is actually actively curated by the global fertility industry because there is a universal desirability for whiteness. So jarring terms, white eggs, black eggs, whiteness, blackness, especially perhaps in this audience, but I should say that this is how the fertility world talks about gametes. White eggs, white sperms, black sperms. Black eggs are nowhere desired in the global fertility world I study. In national context, of course, you will read work by scholars in the United States who talk about the high demand for African-American women as egg donors, but that's not the reality of the global fertility world. Whether you are a single man sitting in China or you are a single man sitting in Israel, and you will be demanding white egg providers. Doesn't matter what the color of your gestational surrogate is, as long as she's cheap and available, that's fine. But for the white egg donor, the whiteness is what is desired because there is resemblance match. And again, I can get to that in case there's confusion. I can get to that in the Q&A. But that is what is curating the demand for cheap whiteness, is that people want to save some bucks, but they also want authentic whiteness. So southern whiteness is actually really desirable because unlike the Viking sperm, which some of you might have heard about here, South African women are placeless. They're neutral. They're cheap, but they're also authentic. So this curated mobility of white egg providers and the curated immobility of the black gestational surrogates, the extractive labor that the black gestational surrogates provide all across Asia and Africa, the fact that their reproductive labor is so important for this industry, yet their genetic matter is erased, is what is keeping the global fertility industry going. And I can go on with that after the dialogue.
Thank you very much, Amrita, for this extremely powerful presentation. We are decentered, aren't we? So please, Jean-François, could you...
Yes, thank you very much. Thank you, Marie, for this invitation. Hello, everybody. I'm very happy. It's an honor for me to represent Médecins du Monde France here in your congress. As you know, Médecins du Monde France was born in 1980. We are working in 30 countries. In France, but also in 29 countries abroad. We are part of international networks with 17 chapters, MDM Spain, Belgium, and other actors. And we are working, our work is based on a humanitarian principle, you know, impartiality, independence, sometimes neutrality, even if neutrality for me is not an evidence. I mean, I'm thinking we are not neutral, but we will not discuss about this now. And of course, we are an NGO, apolitical. That means we are not for the left side or for the right side of the political environment. Even we are not in the middle, but we are, of course, we are a political organization. That means we fight for defending policy against inequality, when we talk about medical access, when we talk about ecological issue, when we talk about, of course, social issues. So we are a political organization, and our legitimacy to make some advocacy come from the field. And we have 4,000 people, volunteers and salary, working in France and also abroad. Of course, we are trying to propose access to a right and also to a medical facility. And our principle to work is based on working with local communities, so with a communitary approach, and also with a local partner. Okay, a lot of local organization coming from civilian society, and we are really care about not providing neocolonialism approach. And so working with a local actor and try to improve their life condition. Our priority regarding operation action is based on, of course, migration issue. That's why I'm here, and I will talk about it just after this small introduction. And we're also working on sexual rights and reproductive rights, and we are working on the harm reduction issue for drug users, but also we are working on environmental health issues, and also, of course, we are working on a crisis field, you know, like war field, international or civilian war. We are working in Syria, in Gaza, in Cisjordania, in Yemen, in Congo, well, in many places. And as you know, there are more and more long-term conflict at this time with a strong impact on mortality rate for civilian population, but also for humanitarian actor. Last year, it was something like more than 400 humanitarian actors who die in conflict area, killing by military actors. And just remind that, for example, in Gaza, it's more than 300 humanitarian actors who die under bomb. So, regarding the migration issue, of course, we try to work at the beginning of the migration road, and also during the migration road, and also we try to work in the country where the people arrive. For example, in Europe, also in France, but also in Belgium, in Italy, through our international network. We are working in transit area like Turkey, like Darien area, you know, in America, where the situation is very, very tense and it's very difficult for population. And also this difficult life for people trying to cross between Panama and Colombia in Darien area is more and more difficult, at least since Mr. Trump arrived and take the power in the United States. So we try to fight for health right. For example, in France, we call aide médicale d'État, medical aid from states, which is a specific aid, which is every time attacked by a right and extreme right party, by using different stupid arguments just to destroy this capacity to provide a health facility for poor people. And we also try, of course, to support, as I told you before, local NGO who work abroad. And our objective also is to show how the policy can have a strong impact on morbidity and mortality rate during migration road. For example, in Darien, as I told you before, in America, or also in Europe, we try to show how decreasing the legal road to reach our continent, increasing the risk taken by the population, and so increase the mortality rate during the migration road. You know, there are many thousand people die in the Mediterranean area sea since long time. Last year, IOM showed that 72,000 people die during migration process, not only in sea, but also on desert or maybe in different place. The majority of those 72,000 people dying, they are dying in war context, you know, and majority of those people who are dying during migration road come from unstable area like Afghanistan, Sudan, or Yemen. So for us, it's very important to fight and to show that some policy, even when we talk about Mayotte in 101 department in France, showing that put pressure on migration by increasing control, policy, and military area, increase the mortality rate for people who try to reach Mayotte or also reach Europe. So we work, as I told you, in many places like Lebanon, Turkey, Gaza, of course, you know, Gaza, there are a lot of migrant, refugee, and displaced people. And it's a very specific place because you have migrant, displaced, all displaced people, all refugee that came in Gaza, and now everybody is in a prison and they are dying under bomb and because of less of food and drugs, and so it's a specific place to document what's going on for refugee, displaced people who are in big prison, you know, and that's why we try to document with ICM and with Palestinian actors this specific place, also in Cisjordania, and try to show how it's difficult to work during a colonialism process. So maybe just what I want to say is, after we start to debate, is that, well, I work on migration issues since long time. I read all the book of Michel, of course. So I have a huge knowledge, and also I was on the field in Nigeria, in Eritrea, in many places where there are a lot of migrants. And it was interesting to see that in 2001, and when I was in Niger, I can see all the migrants coming from the south and through Niger and try to reach Europe. And at this time, it was not a subject for, and it was not a priority for NGO to work on that issue, even in France. And the situations change a lot. And what was for me the rupture time was two things. First of all, what we imposed to the Roma people, so the migrant, European migrant, people at the time of Sarkozy, where it was in France, and I will talk about French issue, where there was a huge level of violence through Nicolas Sarkozy power, and we can observe a huge number of destruction of campment and a lot of Roma people after many destruction of the camp finishing on the road with baby, without food, without clothes, without treatment. And it was first time for me after being abroad to see a high level of a huge number of people without nothing in the same place in France, and so it was the good time for me to realize how our democracy can create also humanitarian issue. And the humanitarian issue are created by politics here in Europe because we are a rich country, and if there are people in the streets, it's because our politics choose to create this situation. So the humanitarian issue is created by politics here in Europe. I mean, in rich country, even in America. And so at this time, it was for me interesting to see that in terms of humanitarian response, we were obliged to use the same method we use in a war context. I mean, working on access to health facility, to water, food distribution, provide shelter for people, even in France. And after that, of course, it was the time of Calais and Grand Saint, so the situation in the north of France between 2010 and 2015, where you were between 5,000 until 12,000, sometimes 15,000 people in bad condition around Calais in the north of France, where people try to reach England. And I realized at this time many things, and different kind of strategy used by France, but also Europe, to realize the policy of migration issue. And we can imagine and we can realize at this time how the French authority, but it's the same thing in other countries in Europe, how our political actors use the violence as a tool, as a legitimate tools in their own policy. That's mean create a bad life condition for people by destroying all the place they try to build to survive in Calais and Grand Saint, destroy all the material provided by NGO. So the authority assumed the fact that violence is used as a tool to realize institutional policy. And for me, it was interesting to see that in our democracy. The other thing is, the other strategy used was criminalization of aid. We talk about daily solidarity at this time, the crime of solidarity, which today is not used because it has not been accepted at the legal level, but we can see on the field every day, and we are working in the border between France and Italy, in Menton, also in Briançon. We are still working in Calais and Dunkirk, where the situation is very tense today. We can see how today the tension is important and how the rights are not respected. People are sending back before having the possibility to open the right, to be aware about the right. Pressure coming from the police's force are very important to our team. They are very intimidation. So even if the crime of solidarity is not effective as a legal possibility for state to put pressure on volunteers, it still have some action who put pressure on NGO and civilian society who work and support migrants. So I realize how also putting pressure on NGO and volunteer is a kind of strategy to limitate, the arriving of migrant population. We will discuss about this, I think, after, because You know, there is a strong offensive against international solidarity, against research also, coming from under populism ideology and under extreme droite ideology. We can see that Mr. Trump destroyed USAID, you know, the American institution who provide international aid. We know that also European country announced end of 2024 a decrease of 50% of the aid public or development public health, and all this kind of decision is under pressure of populism and right extreme. And it's really, for me, a symptom of democracy regression, you know, and it's really an ideology who want to kill us because those political actors want to destroy our democracy, and so destroy democracy through killing NGO and killing researcher actors who can provide data to support solidarity. So the other thing, and I will finish by that, what I can observe at this time of between 2020 and 2015 in Calais and Dunkirk around this crise de l'accueil, you know, welcome crisis, that's what we call. So using violence, criminalization of aid, also to develop more outsources asylum management. That means, ce qu'on appelle, we call it in French, gestion externalisée de l'asile. That means we use country abroad like Turkey, Libya to control migration process out of the European border. And the fact is that, for example, as Italy do with Libyan authority, we don't care if we have to face and if we have to deal with mafia people, and we know in Libya there are a lot of unrespect of human rights and there are a lot of torture, and it's not problem for European country and even Italy to deal with this kind of people, because the objective is just for them to ask them to keep migrant far from our border. And so it's completely a process where we don't respect human rights, and it's something which is was for me very impressive. And maybe the last thing is to also to observe how migrant can use as a scapegoat, you know, in France, just not to for our politics to fight against inequality and to create conditions to provide politics against inequality by using this scapegoat who is the migrant, and saying that, you know, if we forbidden the capacity for boat to save life in Mediterranean, that's what Mrs. Meloni tried to do. If we do that, that means that in France our life process will be better, you know. And so this kind of instrumentalization of migration issue for me was new to observe, and of course it's something we try to fight. And just to finish, what for me also it's something we have to work on is how our policy regarding migrant issue in Europe is based on supremacism ideology. You know, when we receive a million of Ukrainians in 2022 in Europe, we create a transit permit and we create facility for those people to come in France, in Spain, in Italy, in Portugal, of course in Poland and Romania. But it was not easy, but we create the condition for those people to come here, to have the capacity to be protected, to work and to have child, and of course hoping that they can come back at home. But when we talk about people coming from the south, it's create tension between France and Italy, and nobody wants to assist them, and it become a big mess at a diplomatic level. And so for me, it's a sign of supremacist approach, kind of racism approach in terms of migration policy. Thank you.
Michel.
Thank you, Marie-Caroline. I'm very happy to be here in this IMISCO meeting organized by ICM, which is a very nice thing. Of course, we could talk about vulnerability of all existence, as shown by the COVID-19 pandemic, as shown also by the global and pervasive form of global warming, all vulnerables. But of course, it's obvious also that this vulnerability differs according to the context and to the trajectory of the existence of each person and each society. And it's a complex issue for the humanitarian context, where vulnerability is the central concept along with emergency. Then my topic is vulnerability is linked with undesirability. Those who are said to be vulnerable are in this condition because they are in one way or another undesirables in the society from where they come. It is the reason of their displacement and of their encampment. And then long-term treatment as undesirables in camp in particular, but not only, creates even more physical and mental vulnerability. So my point is, how does the humanitarian movement manage this vulnerability and undesirability link? We can refer very quickly to the recent history of the contemporary humanitarian movement. In the 70s, we had something which is about international solidarity with the so-called French doctors, MSF, MDM, and so on. In the 80s and 90s, the liberal globalization embraced humanitarianism as the general argument for a virtuous globalization. Many wars, many violence in the world in the 80s and 90s called for the intervention of humanitarian organization coming from this liberal democracy. In the 2000s, the turning point in 2001 and the attack on the Twin Towers, we saw that the role of humanitarian government in world politics was beginning to change. I called it in that moment the left end of the empire, like Pierre Bourdieu has called about the social workers in France, the left end, the side who take care, who cures, when the right side of the state was being violent and segregative. Then the left end of the empire is one end that strikes when the other end cure and care. We saw this in Iraq, in Afghanistan, Libya, etc., where the humanitarian argument was always associated with military, global or international intervention. On the African field work where I've been made my investigations, we could see what means the violence of the encampment and what happens exactly in the refugees camps with hundreds of thousands or millions of people in diverse hundred of refugees camp or IDP camps. The sorting of populations, the power of the humanitarianism, and in a certain way, by this sorting of population, who deserves care, who deserves shelter, who deserves refuge, who doesn't, doing the dirty work for our liberal democracies. From a European point of view, the confusion between the humanitarian camp and the security camp was increased. Reception centers, detention centers. In France, detention is going to pass from 7 days in the 80s to 7 months in the next or the latest government bill willing to extend the maximum possible length of detention of thousands of foreign nationals in administrative detention centers, les centres de rétention administrative. The link between vulnerable and undesirable is concrete, is very real when millions of people are living years of their life in encampment, in refugees camp or IDP camps, even of course many years after the emergency moment. If the people are maintained in camp, then it is not anymore an emergency question, and it is not exactly a vulnerable question. Encampments then developed in the 2000s as a project to make some people disappear socially, turning them invisible, or possibly physically, in a way that we don't know about it. Third point, now Gaza. Many people said Gaza is a speciocide, an herbicide, a futuricide, and probable genocide according to the international community rules, since the civilian population is directly targeted with attested intention of extermination by the highest Israeli military and political officials. Is Gaza a death camp? In the beginning of the 2000s, I discussed Agamben theory about the refugee camp like if it was a death camp. I defended the idea that in the refugees camp something is paradoxal. If there is a political encampment as a political decision to take people apart, there is also inside these camps a social life, a political life, a cultural life, which is retaking after 1, 2, 3 years. The people are not exactly anymore in a camp as externally life, but they are in their proper home, as frequently Palestinian people told me also about the right to return, which is the revendication of the Palestinian movement. They said, okay, the right to return, but with my camp. And then what happens in Gaza is probably giving the idea that perhaps Agamben was right. Gaza as a death camp. All Gaza is a camp, or as many people say, like a prison, or also in the proper Gaza there are 7 refugees camps, and then people encamped in the proper camp of Gaza. Gaza is besieged, destroyed, massacred, and in a process of disappearing. In Gaza, the humanitarian blockers followed by the creation of the Israeli-American pseudo-NGO GHF, Gaza Humanitarian Foundation, a private company distributing food, aid, or resulted in more than 580 people killed and nearly 4,000 injured when they went to this distribution center in search of food, according to the UN declaration. GHF employs a private militia that shoots people presenting themselves for food aid, as also does Tzahal, the Israeli army supported by United Nations and many humanitarian countries, has bombed hospitals, schools and refugee camps in Gaza and delegitimized UNRWA, the UN agency that vaccinates, feeds, cares for and educates millions of Palestinians. More than 100 humanitarian and UN personnel have been killed by the Israeli army. So it could mean that we are in a new moment for humanitarian movement. Humanitarian care is falling from its pedestal, and it's a brutal fall. Does Gaza represent a tipping point, as Joel Glassman, historian of humanitarianism, has written recently in an article? And is this turning point the continuation of the reorganization of the world that began in 2001? Glassman said humanitarianism is desacralized in the very countries where it was born. Whether we start the founding of the humanitarianism with the founding of the Red Cross at the end of the 19th century, or the contemporary humanitarian movement, as I said quickly, in the 70s with MSF, MDM. That is to say, humanitarian organization which for 30 years believed they were the human face of liberal globalization. Now disowned by the so-called Western countries, which are increasingly illiberal and authoritarian and governed by the extreme right in USA, in Israel, and in several European countries. Of course, we had the beginning of the first signals of this with the concept of humanitarian war used by certain governments to justify their intervention, such as Sarkozy's, him again, Sarkozy's France in Libya. But this was just still, I think, ideological manipulation that didn't change on that moment concrete things on the ground of humanitarians. This turning point was also prepared in Europe by policies against the right to asylum, against the Geneva Convention, which gradually put an end to the right of asylum without touching the 1951 Convention of Geneva. Jean-François has developed all this, but is this changing or suppressing the Convention of Geneva the next step? Or, as Naomi Klein has soon analyzed in her book on the rise of disaster capitalism in 2007, it was prepared by the fact that the leaders of this unlimited capitalism more and more considered that humanitarian aid could no longer be the responsibility of young leftists committed to solidarity, but should be of private companies with more technology and less ideology, and therefore more subservience. It is a policy of disaster, perfectly achieved with the crushing of Gaza and its population, made more vulnerable if still alive. A pariah population which can disappear spatially or socially with confinement in camps, and politically with the status of statelessness. Palestinians are considered statelessness by the UNHCR, like also Rohingya people, with more than 1 million Rohingya people in the Cox's Bazar camps in Bangladesh. And thus, the possibility of a disappearance which could be made invisible in the context of this social preliminary disappearance. Hannah Arendt wrote that refugees must be made famous. The disappearance of undesirables is the opposite of this celebrity. Reading Arendt the Jew, Arendt the refugee, is necessary because it helps to politicize thinking about vulnerability by linking it to undesirability and by pointing out what she said many times, that the stateless as supernumerary population highlights the crisis of the nation state. Thank you.
thank you so much, I mean, for these three extremely powerful and proposals. Before giving you the floor for a Q&A session, I would like us to react to what we could think together. You've been showing, I mean, you've been exploring the mechanism of definitely of control, of selection imposed on migrants, on mobile bodies. You've been showing also that maybe we are in a turning point, looking at this globalization movement with racism, colonialism still being the major paradigm to analyze this movement. So would you perhaps react to one another talk regarding these, these two questions? First, this mechanism of control and selection on migration and bodies, and second, the turning point in we are living right now with this extreme example of Gaza around this globalized movement and what we call this paradigm of colonialism and racism, which is always embodied in this globalized way. Amrita, you want to react first, or?
Sure, I could, because I did want to pick up on some of the keywords that were brought up by Jean-François and Michel here, because even though they might not starkly connect with what I presented today, they actually do. So as I said, for my in my entire academic career, I have been talking about birth technologies, but recently I've turned my attention to what might seem the exact opposite of birth technologies, technologies of death. But in fact, I try and argue that they sit on the same continuum, birth technologies and technologies of death. And in the current geopolitical moment, since we are now talking about Gaza, and I have to say that I really appreciate that there still exist these kind of spaces where we can talk about Gaza without feeling like we might be watched, which we perhaps are being watched. But in coming from South Africa, I do have to say that I feel very privileged to be in South Africa as an academic at the moment, because that is one of the safest places to talk about Gaza for now. And I spent one whole year in Harvard last year, and I realized what spaces should not be like, where my kids were being searched for chalks because in case they go and scribble Free Palestine in Harvard Square. So these kind of spaces also exist, but these kind of spaces also exist where we can actually talk about Gaza without having to use proxies. But I did want to mention that birth technologies and technologies of death, and what you're making us talk about, Marie, about control, actually do connect in really stark ways. So for instance, what we are seeing in the geopolitical moment of warfare is the deployment of artificial intelligence, killer drones, programmed kill lists, precision-guided smart bombs. And these are very high-tech machinery of violence, but what they allow us to do is allow settler colonialists to do is to evade accountability, by obscuring intent. It's a very different story when you are carrying arms, and it's a very different story when you think about human beings as collateral damage, and that does do something to the narratives of humanities. But what I did want to connect with between technologies of death and technologies of birth are two things, is that technologies of death are also not wartime anomalies. They are actually programmed during civilian times, during peace times. We give it our consent through things like predictive policing, through algorithmic curated social media, biometric databases, all these things that are what we are consenting to and complicit to, which are based on racialized and gendered structures of inequality. These peacetime technologies, unless we scrutinize them, then are used in wartime to make humanity a very different space. So that was one thing that came to my mind because of the work that you do, Jean-François, and what you mentioned, Michel. The other keyword that you brought up was about desirability. And I think continuing that chain of thought around desirability and vulnerability, the context of disposability is something that I've talked about a lot, about Black women's bodies being used for labor and for extraction to create the future. So when we talk about the fertility industry, what we are doing is that we are creating the future. We are dreaming what the future will look like, and our entire industry is helping us curate that dream. In the curation of that dream, certain people are desirable, certain people are undesirable, and those narratives go sometimes together with disposability. But in my work, I have talked about the myth of disposability, which is such a clever tool of disciplining and of curating who is another, who is desirable, who is undesirable. So I'll give the context of surrogates, for instance. Surrogates are disciplined in whether in the clinics and hostels in Kenya and Ghana or in India, Nepal, and Cambodia. They are constantly told that they are disposable. They are disposable because if not your black body, we can use someone else's black body to produce another white child. At the same time, they in fact are not disposable at all because as you would know from countries in Europe and in the global north where surrogacy is only allowed in altruistic ways, not many women are ready to gestate a baby for free. So that's why people are moving to the global south, and that is why these women are actually not disposable. But this myth of disposability is so powerful, even for migrant labor. As you were talking about, Michel, I've done quite a bit of work with Bangladeshi, Lebanese, and Ethiopian domestic workers. And the myth of disposability, the fact that they do dirty work, the myth of stigma, all these things and the othering of certain kind of humans and bodies is so important in creating these borders and these structures of desirable and undesirable. Let me leave it at that.
Yes, maybe as we said before, what is probably new is the acceleration of this double attack coming from the ultraliberalism ideology and also supremacist and racist ideology in our democracy. I mean, of course, in China, in North Korea, or in Russia, we know that this authoritarianism system and political system has put a strong, destroyed a huge part of human rights. We know that. But what is new is that these two this double attack coming from our democracy. And as I said before, through the announce of cutting and destroying US aid by Mr. Trump or decrease 50% of public development public health in Europe, those announcements are linked with a certain ideology who want to stigmatize women, LGBTQ plus community, migrant, poor people, and all the program which has been cut by Mr. Trump are all those programs who are not agree with his own ideology. And so it's really, we are in the middle of a battle for right, for value, and for ideological and political issue. And what we have to know is that, of course, those announcements has a strong impact for patient. We know that thousands of people die because of not having IRV for HIV, for example, because a lot of NGO has to stop their own program immediately. Even a strong decrease of fund for UNAID, for example, UNAID actors. It's part of UN activity. And the decrease of fund for UNHCR, for UNICEF, for all also the UN actors, but also decrease for PEPFAR, you know, which is a program for fighting HIV also in the world. It's an American program directly linked with the president. And so you have thousands of people who are still dying now, a lot of women without who are pregnant cannot be followed, and they have died and they will die because of problematic delivery. And there are some models showing us, I was discussing yesterday with a person from UNAID program, that probably we will have 6 million or 10 million of people who get HIV within 3 years because of this brutal stop of supporting program. So what is important is that this announce is very brutal, and it creates no capacity for people to find alternative. And what we have to know is that until now, as Michel say, the humanitarian action was a good face of the Occidental culture, even if many other cultures have developed by different way solidarity process in their own culture. But humanitarian action for the Occidental country and through NGO, we were a kind of soft power, you know, for those countries, saying that our NGO, like MDM, MSF, and other actors, we can receive funds from those governments because we represent the same point of view regarding the defense of human rights and same value. But now, with those new government focus on right extreme based on the populism ideology, they are not considering us as a soft power actor who can support their own ideology, and they will provide now fund to their own fund to different other actors who support pro-life approach, who support not proposing contraception and abortion. And so we now, I think, majority of the researcher corps, the majority of NGO, who try to provide objective data. If we talk about environmental issue, if we talk about public health issue, we try to provide data to give advice for politics to take decision who can respect the general interest, you know. And with this new approach, ultra-liberal and supremacist and racist approach, they don't want to take political decision based on data and science evidence. They just want to take decisions through their own conviction that they are human and they are under human people, and people can die because they are, I don't know, they are different culture, and so they are creating conditions to destroy counter power, you know, and all those actors who create controversy, debate, you know, and so they are, as I said before, they are killing the democracy, and this is something which is very important to advocate to our concitoyens, to all the civilian people, saying that by killing research program and by killing NGO, they are killing democracy, and that's something which is very. This is an emergency. I mean.
I think, as Jean-François just said, there is a strong ideological movement going to what we call extreme right, which is illiberal, which is against democracy, and we put which break all the history of the humanitarianism. But I think there is also, and then I speak also with Amrita, there is also a technological evolution. When I say, I referred to Naomi Klein when she said in 2007, there are movements in the proper humanitarianism and in the government in general, who say that humanitarianism should not be left to the responsibility of young leftists speaking about solidarity, but should be privatized with more technology. What we see in some important refugee camp is that this technology, including a technology organized by UNHCR with private societies or by consortium of NGOs, goes in the technologization or the informatization of humanitarianism. You have in many refugee camps for Syrian people, for example, as Lea Macias showed in her doctorate, in her PhD work recently, you have an informatization of the management of the refugee camp, which makes, for example, that, of course, even if you don't have any refugee card, you have a register of the fact that you are recognized somewhere as a refugee, and this is on your eyes, on the iris, and then you have right to some food, but the same eye, the same iris in another place in the world can say that you are not anymore a refugee, considered as a refugee, or that in this other country you are not recognized in the refugee, even if you are in the former country. The organization of global datas and these global technologies about the management of the people in care of humanitarianism, refugees, displaced, illegal migrants, and so on. This technology of data is already on the world, and then one can say now that it is not an ideological point of view; it is a technological point of view, and in the same way, in an Orwellian perspective, we can hear what you say about also a technology of reproduction, where black women can reproduce white people, and then we have to take care of them, but they remain undesirable when they finish this work. And that's an horizon where I think the main turning point, which Gaza is meaning obviously for everyone, the turning point is current since some 20 years or more.
Thank you very much.